I thought, are you giving me gold or jewelry? What are you giving me? No, it was a bottle of Perel. But they're world famous as the best mask makers. As I breathe, front to front, second step back to back, third step in between. Spoiler alert, it's not. Or wear gloves. And you don't have to get the disposable gloves. You can just wear your ski gloves. Let me just tell you, if you come to my neighborhood, you're gonna see more Maseratis. Forget BMW and Mercedes. Those are like common cars here. Yeah, and I'm Dr. Michelle Savu. I live here in Beijing, China. Deputy Chief of Surgery at Beijing United Hospital. I think finally Americans are starting to understand the risk, and so you're taking precautions. So what I want to talk about today is the use of PPE or personal protective equipment, and what is your real risk. And Coco is really interested to help me with this video. Let's talk about personal protective equipment. That's what we in the medical field talk about with masks and gowns and gloves. The World Health Organization on their website actually agrees that masks decrease the spread of respiratory infections. The thing is, they say you can't use the mask alone. If you have a mask, I would wear the mask. There's certain things about masks that you need to know, and one of them is how to put them on and take them off correctly. So I'm going to show you now how to put on and take off a mask correctly. And also I'm going to talk about what's the difference between the surgical mask, the respirator mask, the N95 that you hear us talking about. And then I'm going to talk about what is your risk. If you walk by somebody in the grocery store, is that a risk? It's not. Spoiler alert, it's not. Here is what they're calling a surgical mask. It has these two elastic loops on the side. And the way you put them on is you don't touch the front, you put it on here, you put it over your ears, you pull it down, you pitch it to your nose, and then it's on. How you put it on is important, but more important is how you take it off. Because once you've worn it outside, now this protects you from splashes and sprays, and it's called source protection, which means someone who's coughing or breathing out the virus, this is keeping them from coughing and breathing it out to everyone. That's why they work if everyone wears them. Of course, in Asia, they have much more of a mask culture, so they're used to wearing masks, mainly for pollution. But in any case, to take it off, this you must always not touch and assume that it's dirty. To take it off, you go to your ears and you bring it off this way. And so that's the correct way to take it off. And then if you're going to throw it away, you let this side go inside. The place towards your mouth goes to the inside and you throw it away that way. And then you wash your hands. That's the important thing. And then the second type of mask, now this is an actual surgical mask, and the difference is that we tie them around. They're not so easy to reuse. You're at the stage in the United States, you don't have enough supplies, you're gonna have to reuse your mask. The only difference between this one is, and I wanted to show this one, is the outside of the mask is blue, the inside is white. And usually that's how you should do them. So the outside is blue, that goes towards the outside, the inside is white. Sometimes you can tell because they have a word on it, or you can tell because the nose, it has metal inside, and the nose thing goes a little tight this way. And we will tie it when we do surgery. I'm a surgeon. So we will tie it, but then when it's hard to get off, and off, usually we just break it off. That's that. So what am I gonna do? I'm gonna go wash my hands because I took off a mask. Okay, so now I got a little smarter and I have my Perel here. This is kind of funny because the nurses said, oh, my son was flying to Seattle. They said, let me give you a gift. And they literally took out a key, opened up a lock cabinet. Inside the lock cabinet was a safe. They took another key, opened the safe. Inside the safe there was another key. I'm not exaggerating. They took that other key, disappeared to another room, and this is what they brought out. That's how under lock and key this stuff was, like gold. I thought, are you giving me gold or jewelry? What are you giving me? No, it was a bottle of Perel, oddly enough. But now that's eased up for us too. It will for you too. So now let me tell you what an N95 respirator is. These were created to filter air and small particles. The 95 comes to tell you it will filter out 95% of particles that are 3 microns or larger. The virus is around 1 micron, and so you say, well, how does that work if it's smaller than the 3? But the virus can't come alone. It has to go on some kind of carrier, and the carrier molecule is a water particle, and that makes it bigger. So this is made truly to filter the air. The most famous manufacturer of this is 3M, which stands for Minnesota something, maybe mining, I think. I guess they started out in something different, but they're world famous as the best mask maker. So the U.S. company is the best mask maker. They do have factories in the United States. One's in Minnesota, one's in Dallas. I'm sure they're revving up. I'm hoping that our government has started using other factories such as car manufacturers and iPhone manufacturers, just like they did here in China, to rev up production of masks. In any case, this has to fit much tighter and does fit much tighter than the mask we use just for the surgical mask. This will filter about 60% of the air. This, but it's not tight. So we know that particles can get through this, but this one's tight to your face. So this one's harder to put on. You got to put way over the whole thing. Probably should take your glasses off before you do that. And then over this, and you can see, and here, this is much tighter. I'll push this. It's more uncomfortable to wear. And as I breathe, you can see it's going to bring in, because it's tight around my face, it doesn't leak, and then it filters the air. The thing about this is that this is used by the healthcare workers when they are going to see with someone with a fever or a suspicious person under investigation for a viral disease. They use it for the usual flu too. When they did a study, if the patient who was suspicious for influenza had on a mask and the provider put on a mask when they were within 6 feet of that patient, both this N95 mask and the surgical mask were equally effective. So they showed these two to be equally effective, and these haven't been studied 100%. Their studies are hard to do. So either one of these are going to work. They work a lot better if the person who has the infection also has the mask on. Now, hand washing is the key, or using the alcohol, 60% or higher alcohol. Hand washing, there's 6 steps to it. The first step is front to front. Second step, back to back. Third step, in between. Fourth step, do your fingers, thumb. Fifth step, do the fronts of your fingers in your palm. Last step, do your fingernails in your palm. This is with soap and water. And that should be done for at least 20 seconds. That should be an effective wash of your hands. What are your risk factors if you are, let's say you flew? Is the whole plane at risk? The truth of the matter is no. They've done studies on this, and you're basically at risk if you're within 2 seats distant from the person who has the infection. And then if you're farther than 2 seats away, but 6 feet within the range, then you're considered low risk. And then the rest of the plane is considered no identifiable risk. So that's pretty amazing. One of the reasons is that planes filter the air really well, as opposed to other modes of transportation. If you have to take public transportation, probably a bus, because keep it with the windows open is your safest bet, because they constantly open and close the bus, the air can circulate more. Maybe your higher risk are the high-speed trains where they don't filter the air as much, the windows don't get open on the high-speed trains. So those are some common things about risk. Now the subways, unfortunately underground, is gonna hold the air a little bit more, and they do open and close at the different stops, but that's a little bit. So if you have to take public transportation, and hopefully you don't, but if you have to, then try the bus or a bike. Here in China, they use the bike a lot. And let me just tell you, if you come to my neighborhood, you're gonna see more Maseratis. Forget BMW and Mercedes, those are like common cars here. We're talking pink Maserati, pink Porsche. There are cars I never knew existed, could be bling. At one time, I saw a Mercedes covered completely in Swarovski crystals. It was unbelievable, outside the Pearl Market. Unbelievable. Don't be thinking these people are on bikes because they have to be on bikes. But if the bike is the way you can go, that's a healthy way. You're both getting your exercise and you're not close to people and you're getting the air circulated. So I guess I'd say the bike is the best way to go. So what about if for some reason you were in a waiting room with people? What kind of risk factor do you have there? The way the CDC puts your risk factor is whether you had close contact. Close contact definition is in an area with a known COVID positive patient within 6 feet for a prolonged period of time. They don't define prolonged period of time, but about 15 minutes is what is considered prolonged period of time. That's considered close contact. That's one. And two, the other consideration for close contact is if you have touched this or had the secretions of a known COVID positive patient on you. Someone sneezed on you, coughed on you, or you touch the Kleenex of someone who had sneezed and coughed who is COVID positive, and then don't wash your hands. If you touch the Kleenex from someone who is positive and you wash your hands, that's not considered high risk. If you were in close contact, then you are at a higher risk and you need to probably get tested, and that's for known COVID if you're in close contact. If you go to, for instance, there's a grocery store and someone was positive in that grocery store and you happen to go shop later in that grocery store, that is not considered high risk. So just walking by somebody who has the virus is not considered high risk. You basically have to be in close proximity to them in a room, a waiting room, or a closed room for a prolonged period of time. Don't think that just walking past someone with the virus is going to put you into high risk zone. It doesn't. If you just shop in the same supermarket afterwards, then that doesn't put you in the high risk. I do recommend that you can wear gloves when you're shopping because it can stay on surfaces. It does stay on hard surfaces for days. So if someone sneezes in your hand, picks up a can of ketchup and touches every other ketchup in the area, it's possible it's still in that bottle. So I recommend washing your hands frequently and or wearing gloves. And you don't have to get the disposable gloves. You can just wear your ski gloves or any kind of glove. Have a fever. What are you going to do if you have a fever? Fever can over 100 degrees Fahrenheit. Here is 37.3 degrees Celsius. If you have a fever, the first thing you're going to do is not go to the doctor. You're going to call your doctor and you're going to basically watch your symptoms. If you have shortness of breath, cough, and a fever, that's when you're going to need to get more help. Let's say there's someone in your family who has COVID. You can take care of them, but you need to use the personal protective equipment. For healthcare workers, they tell them if you can't use a mask and throw it away each time with goggles and gown and gloves with someone who has COVID, then you can keep the mask on and the goggles on for seeing multiple patients one after another. And the risk of transferring it from you to them is very low, and the risk to you is also very low. As long as the mask doesn't get wet or damaged. As soon as it gets wet or damaged, you need to get rid of the mask. And I showed you how to fold it inward so the place to your mouth gets folded inward and thrown away that way. Now, even the WHO and the CDC says some kind of protection is better than no protection. So even for the healthcare workers, the next choice is if they don't have a mask, that they should wear a face shield that covers to their ears and down to their chin. And the last resort, even according to the CDC, WHO, is some homemade kind of mask will help. So I think that those are some good suggestions and knowledge. You don't need to be so fearful. If you just go outside, today's a nice day for us here. If you just go outside, go for a walk, you pass someone who actually has the COVID, that's not a high risk. Remember, one of the key things about this virus is it is shedding virus and spreading to other people from someone who's infected, but the person who's infected doesn't know they're infected. And in fact, you could have two people side by side get sneezed on or coughed on by a COVID person, and one of those people might develop the symptoms and the other one might not, but probably both of them have been infected. Mortality rate according to the age group, with the worst age group being over the age of 80. So anyone that you know is over the age of 80, and I would even say over the age of 70, they really have to be sheltered. And I think we get into trouble with these convalescent homes for sure, nursing homes, but I think the other thing is those retirement parks really have to stop having visitors. It's not the time to go visit them. Someone will bring it into me. It will kind of spread through there from like wildfire if someone gets in there who has it. That's where you might want to start screening with the temperatures. Why is China doing temperatures everywhere, even to get in apartments? It's because the temperature is one way to know who might be infected, who is a potential source. They don't want it to get into an apartment complex and then spread throughout the people in the apartment complex. As you can imagine, it gets on the when you do the elevator and things like this, they can spread like that. So what they're doing here for source control, or trying to keep it from spreading, is measuring everyone's temperature everywhere they go. So if you go to Starbucks here, and yes, there are Starbucks in China, you will get your temperature taken there. They'll take your phone number, then you can order. You can't sit in Starbucks. Usually you just get your coffee and you go. Because it's so well controlled here in China, this is the 4th day that Wuhan has had no new cases. So this is a big victory, and people are becoming a little bit more relaxed here in China. So far in Beijing, the only new cases are those who are bringing it back from overseas. Usually these are Chinese nationals who were living overseas and then come back and they're bringing it. But China's being very strict to isolate them. Not only in a designated hotel they have to stay, but they have to stay separate from their other family members. So husband and wife are in 2 separate rooms, plus they get to pay for that themselves. So I think there's a twofold for that for China. They're trying to keep the infection from coming back, but they're also trying to discourage people from coming back from overseas. There's a two-edged sword. The other thing is they're no longer allowing planes from international destinations to even fly into Beijing. They have to fly to outlying cities, like one of them's Tianjin, which would be like a half an hour trip on the train. You will get through this. Finally, I believe America's starting to wake up. To my colleagues in the medical field, please organize yourself according to cities and towns so you know where your ICU beds are, where your respirators and ventilators are available. I just received yesterday N95 mask from my friend in Chicago. When it first broke out 6 weeks ago, I asked her, could you send some masks? She sent me the mask. Now probably I should send the mask right back to her, because here in China we don't need so much anymore, and we have the supply coming back. But this is the time when the world actually has to work together and help each other. You need to learn from what China has done and need to go ahead and start doing those things yourself. You will get through this. Stay calm, stay focused, protect yourself, protect your family, and know your risk. Again, I'm Dr. Michelle Savu. I live here in Beijing, China, Deputy Chief of Surgery at Beijing United Hospital. Godspeed to you all. Our prayers are with you.